This was probably one of the most interesting discussions. So this is a low risk patient who's young, and we had a great conversation about early use of a JAK inhibitor, in this case, Ruxolitinib, to potentially improve overall survival. Although there certainly was called out that this patient would not have qualified for the COMFORT studies just because of his low-risk disease. There was some discussion about whether we need to start treating these patients earlier rather than later, even though they may not otherwise warrant therapy. So the question about whether Ruxolitinib is really truly disease modifying, particularly in a patient who's young. There was also a comment to really strongly think about watching him closely for transplant potential, given his young age, as well as comment that you probably need some molecular risk stratification that may help us guide that decision as well, which was not presented in the case. So looking for higher risk mutations that might otherwise change his trajectory.